On Thursday last week, the federal government, through the Deputy Director of Press, Federal Ministry of Health, Alhaji Shaka Yusuf, announced the suspension of residency training program in all federal hospitals across the country, pending when all challenges in the health sector are addressed. This pronouncement by the federal government appears to have attracted the anger of doctors in Edo State, particularly when issues raised by the Nigerian Medical Association have not been addressed by the federal government. Although the national body of the Nigerian Medical Association has urged the federal government to withdraw the suspension order of the residency training, NMA in Edo State are however going a step further, as the financial secretary of the association, Dr. Baritus Ayanku, in an interview said Edo NMA may close down private clinics as a way of prevailing on federal government to reinstate the residency program.
Can prove to him that to equally go further to stop all the private clinics from operations. We can revisit history, how it has happened in 1980s, where we collapsed even the private clinics, government hospitals, in a situation like this military regime. So if he wants to deepen this crisis, we will help him.
Also commenting on the issue, President of the Nigerian Association of Medical Doctors, UBTA chapter, Dr. Goodluck, and other resident doctors said they are not deterred by the pronouncement of the federal government, but called on members of the public to prevail on the government, as doctors are lifesavers.
The resident doctors are the pillar of all hospitals. We have over 2/3 of doctors, and they are resident doctors. If we are saying resident doctors suspended or sacked, you are saying that there is no longer health care needs of the people of this country.
It's only shocking and amazing that at that same time, when we're trying to sort out these demands, government has now decided to take the draconian measure of suspending resident training and sacking doctors. Like he had rightly said, resident doctors form the bulk of the health force of this country, and if you do that, it means that you've shown to the people of Nigeria that you do not care about the health care, especially time now you have the Ebola outbreak. We feel that this is a time when government needs to show sensitivity, come to the round table and address those 24-point demands NMA has made.
We ask the government to urgently de-escalate the situation and stop the issue of suspending resident doctors in Nigeria. And only then can things resume and start discussions.
Thousands of resident doctors serving at the federal government hospitals are affected by the decision of the federal government. Best Mbiere reporting.